So now we're going to talk about upper respiratory infections, and then we'll talk about lower respiratory infections. So here's the thing. Feedback that I've gotten from students in previous classes is like, how do I keep track of all these things that all sound the same? So what I'm going to do to help you with that, hopefully, is I'm not going to go down and list every single symptom, every single manifestations of every single disease, because a lot of them are the same. So in the last lecture, I talked about general manifestations, coughing, sneezing, blah, blah, blah. And what I want to talk about with each one is how is it different from the other one? So how do we distinguish that from another upper respiratory infection? So how's a cold different from the flu, and how's sinusitis different from croup? So we'll talk about that. So let's go into slideshow mode. Oh, I guess I haven't used Prezi for a while. Maybe I'm over it. Maybe I'll use it for the next one. Who knows? Who knows? So upper respiratory infections, we're all familiar with them. We've probably all had them at one point in time. They call it the common cold because everybody has had it, right? Infectious rhinitis, so nose inflammation, if you want to be specific. It's viral. It's spread through respiratory droplets. Like, we all know too much about respiratory droplets now, don't we? Early signs: runny nose, congestion, and sneezing. That's pretty common for other things too. So common colds, we usually are going to treat them symptomatically. We're just going to let them run their course, right? And confine your respiratory droplets to yourself. Don't spread them to other people. I don't know how difficult. I mean, it's not difficult. We've been doing it for a few years now, right? We can keep our respiratory droplets to ourselves and stay away from people during cold season in the winter time. My sister gave me this coffee mug, and it says, when this nightmare is over, please continue to stay at least 6 feet away from me. So that's my policy all the time. Okay, enough about me being crazy. Okay, sinusitis is usually a bacterial infection of the sinuses. Commonly now, unless it's prolonged, commonly now doctors will let it run its course and treat it symptomatically. There is a problem with the overuse of antibiotics. Sinusitis tends to be our regular normal flora, streptococci, and those guys that are hanging out in our throat that make us sick as opportunistic pathogens. And so we don't want to keep giving them the chance to become resistant to antibiotics by over and over exposing them to antibiotics. So normally these days, they will let it run its course unless it becomes extreme and prolonged, and then maybe they'll do a culture and sensitivity and get you on some antibiotics. Croup is laryngotracheobronchitis. Croup is easier to say though, isn't it? And it's common in children. It's usually self-limiting. So a lot of these things, cold, sinusitis, croup, are self-limiting. We're going to treat them symptomatically, but we're not going to have to take anything special that targets them. Influenza, on the other hand, can kill you. Like many things. It's probably not on the top 10 list, but it's up there, It kills a lot of people every year. In a normal year, which we haven't had a normal year for a while, about 1,000 people in a normal year die of influenza in the state of Washington. It's endemic in the population. It's around. People are going to get it. We do have some epidemic spikes occasionally. The interesting thing is, in 2020, when everybody in Washington anyway, was wearing masks, 0 people died from influenza. So I'm like, hey, I have a great idea. Let's avoid influenza by wearing masks during the flu season. Silly. That's just silly. It's a viral infection. You know how viruses are. They like to mutate. The new thing is, if it doesn't kill you, it'll mutate and try again. So, viral infection with sudden acute onset of fever, marked fatigue, aching and pain in the body. Usually the thing that gets you, if it does kill you, severe influenza, is respiratory distress. A mild case of influenza may be complicated by a secondary bacterial pneumonia because influenza causes tissue necrosis in the respiratory system, opening the door for bacteria. So, never good, never good. So if the influenza doesn't get you, the bacterial pneumonia can back it up and do the job. So just be careful and manage your respiratory droplets. And if you do have influenza, there are antivirals to treat it. Get your flu shot every year, especially if you work in healthcare. Good God, get vaccinated. I don't know how many times I have to say that, but you work in healthcare, come on. Don't make people sick. You're supposed to make people well. Don't go to work when you're sick. Simple, right? This is the chart from the book with the comparison of respiratory infections in children. There's tend to be age ranges. Of course, kids get respiratory infections. Their immune systems are not yet developed. They have to get them, and there are some that can be worse than others. Some are mostly caused by viruses. That's all I have to say about that. Different pathologies, look at your pathologies. The only one that has a rapid onset is the epiglottitis. There you go. Comparison. Lower respiratory tract infections tend to be a little more serious because lower respiratory tract, right? It's supposed to be sterile. Bronchiolitis, where the bronchioles are infected, pneumonia, that's on the top 10 list of stuff that's going to kill you. Legionnaire's disease is bad too. But it's not as common. Good old SARS and COVID. There they are. Now they're part of our lexicon. So interestingly, in the last edition of this book, they talked about SARS, and they talked about how they were working on developing treatments for SARS. And then in the new edition of the book, which came out this last year in 2021, they talked about COVID-19, but obviously the book went to press before the vaccine was available at the end of 2020. And so it says the COVID-19 and they're working on a vaccine. So now we know everything we need to know about COVID-19, right? If not, we'll talk about it, but it's another lower respiratory tract infection. Tuberculosis, histoplasmosis, and anthrax. So all serious, horrible stuff. The symptoms of lung infection or lower respiratory tract infection include shortness of breath, weakness, fever, coughing, and fatigue. The most serious of those symptoms is probably the shortness of breath. So if you're having respiratory distress, please get help with that. If your patient is having respiratory distress, please get them help for that. So there are lots of different types of pneumonia. Pneumonia is one of those things that might get you in the end. So you can have pneumonia caused by viruses, you can have pneumonia caused by bacteria, you can have pneumonia caused by aspiration of fluids. So if you have a pneumonia caused by a virus, very difficult to treat. If you have pneumonia caused by a bacterium, there's an antibiotic that can address it, that's treated by antibiotics. If you have multiple bacteria and multiple drug-resistant organisms, that could be very difficult to treat. This is one of the reasons why pneumonia is on that top list of things that might eventually kill you. So ones that are caused by viruses are usually, they're the primary atypical pneumonias. The pathophysiology is a little bit different if you check out this chart from the different ones. And the one that isn't on here is aspiration pneumonia, and that's not caused by a pathogen, so you can only treat it symptomatically. So if you work in the hospital or the skilled nursing facility, you will be working with people with pneumonia. So you have to work on energy conservation, breathing. A lot of times people are on oxygen, you're monitoring vitals. You're working on activity tolerance, basic functional mobility, all wonderful things that people need to work on. You can see that between lobar and bronchopneumonia and interstitial pneumonia, the onset is different. So lobar pneumonia is sudden and acute. Bronchopneumonia more insidious, and interstitial pneumonia is variable. So when I was in high school, I got lobar pneumonia, and it was sudden and acute. It was a one night I was I think I was babysitting with a neighbor, and the kids were already in bed, and I was probably getting sick, and I lay down on the couch, and the parents came home, and I had a high fever, so they called my parents to come and pick me up, and they took me in and chest x-rayed me, and there it was. I had streptococcus pneumoniae, and I was pretty sick for a couple weeks, and and I was on antibiotics, and they were like huge pills that were hard to swallow. That's what I remember about it. And they gave you a bad taste in your mouth. But that sudden and acute onset, that's typical of lobar pneumonia. So when you look at this chart, look at what's the same and what's different. So that's what we want to do, is we want to compare the different types. What's the same and what's different? Dry cough versus productive cough. High fever versus mild fever. Rales versus dyspnea. Okay, so just look at that and compare and contrast.